Now, when a concept comes by, misconceptions come even before that. So I'm very sure that asthma and COPD have many misconceptions. People have a lot of wrong notions about them. So what are the most common misconceptions that you have come across?
The asthma, the notion is that they look at it like a stigma. That is what, as a chest specialist, I have been, maybe the past 20 plus years I have been practicing. When you tell it is asthma, you can suddenly see them backing off, and like as if you say that you have a cancer or you have a heart attack or something like that. There's nothing to worry about. Asthma is a disease which is totally controllable and which goes away. That's the good news. Let me tell you the good news. The good news is goes away, especially in children when they attain puberty around 12 to 13. May not come back, but 90% of children outgrow their asthma. That's the good news. So embrace the diagnosis of asthma. And the wrong notion about asthma, that is the first thing. Don't think of it as a social stigma. Put your inhaler in your pocket and take it out and use it whenever, whatever you want to. This is a country which has banned smoking, so start using inhalers much. So that's the wrong concept about asthma, that it's a social stigma, and they want to hide themselves behind words like eosinophilia, bronchitis. I just have allergies, isn't it, doctor? No, you have asthma. That's the answer. That should be the answer. You should accept that. That's the wrong notion. Second thing is, inhalers are not being prescribed, even by doctors, unfortunately. Many of the time it's improving. The pickup rate of doctors prescribing inhalers is improving, and there is a wrong notion about inhalers that it is addictive. It is not a smoking device. The inhalers is a canister, a small metal canister which contains medicines which comes out in a gas form and reaches the lung directly. It's a lung ointment. One of the greatest discoveries in modern medicine are inhalers, and asthma's best friend. An inhaler is an asthma's best friend, and the wrong notion is that inhalers are addictive. No, they are not addictive. That is the wrong notion. And asthma is not contagious. This is the wrong notion. Coming to COPD, I think the awareness of COPD has to come in, that there is something called as chronic obstructive pulmonary disease, or an ordinary term, chronic bronchitis or emphysema are also being used earlier. Chronic bronchitis would be the term. Usually due to, as I told you, two main causes. One is cigarette smoking. Second is we have air pollution of different sorts, vehicle pollution, industrial pollution, and pollution of passive smoking. Somebody, the husband smokes, the wife gets it, the child gets it, and cow dung being used as fuel for domestic cooking. So that is also a place where COPD can come in women, because it's quite rare in women unless they are exposed to air pollution in an industrial complex. So the notion about COPD is that it is a preventable disease, so stay away from smoking. India is a no cigarette smoking zone country in the aircraft, anywhere in the public places, and thanks to our health minister, Dr. Anbumani, the Honorable Health Minister, from last October 2nd, if some guy wants to smoke at home, he has to get the written permission of his wife, or the wife can sue. Good for you that still India is not becoming America. Otherwise, you can be sued by your wife, you're smoking at home. So this is a no smoking country. Congratulations to India. But if you don't smoke, you're not going to get COPD. And if you're going to have a social outlook that we, as a private-public partnership, that is what our former finance minister, Mr. Chidambaram, the Honorable Chidambaram, he was talking about private-public partnerships in the last financial statements, that the private people in the hospital industry, the private citizens, that is you and I, have to join hands with the public and the government as a PPP, or a private-public partnership. This is what should be the future to prevent COPD. The notion about COPD is that there has to be a private-public partnership where cigarette smoking or any form of tobacco and air pollution has to be brought down to ground zero, and then COPD will not come. Then the problem of tackling COPD doesn't arise at all. By the way, even for COPD, the treatment is, again, first avoidance of the trigger factors like cigarette smoking and air pollution. The next is again inhalers. So the main theme of my talk today is that both in asthma and COPD, inhalers are the main line of treatment. And if you have bronchitis, or you have allergy and colds and coughs and breathing problems and breathlessness, and you don't have an inhaler at home, please go back to your doctor and request for an inhaler.
What you're now seeing is an X-ray of the chest, PA view. This is an X-ray of an asthmatic patient where the lungs you see on both sides as black shadows are overinflated and the heart is seen in the middle. This X-ray chest is very important tool for the diagnosis of asthma in that it excludes other diseases like tuberculosis, pneumonia, lung cancer, interstitial lung disease. The list goes on. Now you see an X-ray of the paranasal sinuses. You can see the two eyes, and below that you can see two black hollow spaces called as the maxillary sinus. That is the main place where fluid collects and sinusitis happens. Diagnosis of asthma and COPD or chronic bronchitis. What you are now seeing is our pulmonary function testing technologist, one of the best in the world, keying in data like the age, the sex of the person to be tested by PFT or pulmonary function testing, the demographic data, the height, the weight, which is compared with other standards. Now you see him put his mouth over the instrument and cover it and put a nose clip so that he breathes only through the mouth, and his mouth is connected to the lungs directly. He is taking in a deep breath and blowing out into the instrument fully his entire breath. You can see him straining again and taking in a deep breath and again now blowing out slowly. This is how the technique of pulmonary function testing happens. Now he is doing his normal breathing in and breathing out. Again he is taking a deep breath and blowing out fully till every ml of his carbon dioxide or his whole breath is out, and again he is taking in a breath. Now you see the screen where he changes the software to show us the graph of what he is just now done on himself on the pulmonary function testing. The curves that you are seeing are the curves of the pulmonary function testing called spirometry. In the spirometry you see a triangle on the top sitting on a semicircle below. The triangle on the top is the place where you blow out, and the lower part, the semicircle, is where the inspiration takes place. Again, different data is being keyed in to the pulmonary function testing apparatus, and now we are going to see the graph of a person whose breathing is normal breathing. You are able to see the graph going up and down as the person is breathing normally, and these data move according to the inspiration or the taking in of air or the expiration or the blowing out of air. And as this happens, what happens is the software is able to generate an overall complete analysis of the lung function capacity of an individual depending on the height, the weight, the age, and other scientific data which is compared to the international and national data.
Do you know the following are few of the many potential allergens that can trigger or precipitate an asthma problem? Ice creams, curd, pet animals, dust mites, oysters, citrus fruits, cockroaches, eggs, crabs, red wine, pickle, buttermilk, dried fish, yeast, pollen. Well, that was quite informative. Apart from talking to Dr. Ilango, I also spoke to many different doctors regarding the Breathe Easy Clinic, COPD and asthma.